And thank you for joining us today, everybody. Today we will be discussing norovirus in childcare centers and schools. As Kendra has said, we are a portion of the DISH team. My name is Amy, and I am a health educator. And joining me today is Tasnim, who is an epidemiologist on our team. So today we wanted to start this presentation off with a fun activity. So go ahead and scan this QR code or go to the website, wooclap.com, and enter the event code. Then we want to know what the first thing is that comes to mind when you think of norovirus. So I will give everybody a second to scan the QR code, and then I will pull up the link to show you all. Okay, looks like we have a lot of answers coming in. Give me 1 second here. Okay, there's a lot of answers coming in here, but it does look like vomiting is pretty large, diarrhea. As people keep adding, it will clear up a little bit. But it looks like a lot of people are putting the common symptoms of norovirus.
Amy, are you able to make that box larger on the screen?
I am not sure. For some reason, it is. There we go. All right, I see sick, I see GI issues. So it looks like a lot of common symptoms. So thank you all for taking the time to do that, and we will be reviewing your symptoms afterwards. We all may have personally experienced norovirus at one point or have seen this illness at our childcare centers and schools. So while this presentation will focus on norovirus in these settings, we did want to start off with an overview of stomach illness. So there are many types of stomach illnesses, and they can happen for many reasons. Stomach illnesses can happen because of infections from bacteria, viruses, fungi, and parasites. You can also get stomach illness from drinking or eating contaminated food or water, certain medications, stress, diet, traveling, or a change in routine. Norovirus, which is a type of viral infection, is the most common cause of acute stomach illness in the United States, leading to 19 to 21 million cases each year. So let's take a look at the data here. So while most norovirus outbreaks are common from November to April, they can happen at any time during the year. So looking at the chart above, this data is from reported outbreaks in schools and childcare centers. You can see the increase in gastrointestinal illness outbreaks during the norovirus season for both 2022 and 2023, but it is more prominent in 2023. Of the 96 gastrointestinal illness-related outbreaks, there was a mixture of suspected and confirmed outbreaks of norovirus, as well as other gastrointestinal illnesses. You will notice some months have 0 reported outbreaks. This could be due to holiday breaks, summer vacation, and increased reporting given the pandemic. So now let's transition into specifically norovirus. Norovirus is a common stomach illness that causes vomiting, diarrhea, stomach pain, and nausea. It is sometimes called the stomach bug or stomach flu, but is not related to the flu. The flu is caused by the influenza virus. Norovirus commonly occurs in childcare centers and schools. In the next few slides, we will talk about symptoms to watch out for, how norovirus spreads, how to tell when someone is sick with norovirus, what to do if you are experiencing a norovirus outbreak, what we look for at the local health departments, and ways to prevent further spread of illness. You can imagine that being in close quarters, sharing spaces together, and by having many high-touch surfaces, it makes it easy for norovirus to spread in childcare centers and schools. So while most children are able to easily recover from norovirus, a small number of children may have more severe symptoms. According to the Centers for Disease Control and Prevention, norovirus leads to about 1 million doctor's visits each year among children in the U.S. By age 5, 1 in 7 children will visit the doctor due to norovirus. 1 in 40 will go to the emergency department, and 1 in 160 will be hospitalized. And unfortunately, 1 in 110,000 children will die from norovirus. So now let's take a look at norovirus symptoms. The most common symptoms of norovirus are diarrhea, vomiting, nausea, and stomach pain. Other symptoms include fever, headache, and body aches. Symptoms associated with norovirus appear rapidly. In younger children, vomiting may be the most visible symptom. So, what does having norovirus look like? Well, it takes roughly 12 to 48 hours after someone is exposed to norovirus for symptoms to show up. This is called the incubation period. Norovirus lasts for about 12 to 60 hours. This is called the duration of illness. Compared to other illnesses, norovirus usually happens quickly and also resolves quickly. And some people are ill without showing any symptoms at all. This accounts for about 30% of norovirus infections. With that being said, the symptoms of norovirus, including vomiting, diarrhea, and nausea, are definitely not pleasant. So as we know, norovirus spreads very quickly and very easily. It only takes a small amount of particles to cause an infection. From the time someone is exposed to norovirus until symptoms begin is very short. Noroviruses can last on surfaces and objects for a few weeks. That's why noroviruses require specific disinfectants to properly remove the virus particles from these surfaces and objects. Because there are so many types of norovirus that can affect us, immunity is short-lived and we can get infected many times throughout our lives. So, how does norovirus spread? Norovirus can happen in places where many people gather, like childcare centers, schools, on cruise ships, and in healthcare facilities. If you get sick with norovirus, you can shed billions of norovirus particles that you can't see without a microscope. It only takes as few as 100 particles to make you and other people sick. Someone sick with norovirus can continue to shed billions of norovirus particles for 2 weeks after their symptoms go away. There are a couple ways norovirus can spread. One way is from stool particles reaching the mouth. For example, imagine a child or student who used the bathroom and may not have washed their hands well. Then, the child or student can spread norovirus by having contact with other students and staff. Next, vomit particles can also spread norovirus. It's possible that vomit particles spread through the air and land on objects and surfaces nearby. That's why it's important to clean an area wider than the spill itself to get rid of these virus particles. Lastly, Norovirus can spread from touching contaminated surfaces or objects, fomites, and then placing one's hand into one's mouth. This is particularly common for our younger children, since children are likely to touch surfaces or objects and then place their hands into their mouth. So, how do you know someone has norovirus? Norovirus is often detected based on symptoms rather than a test. Because norovirus usually resolves quickly, someone sick with norovirus may not seek medical care. There are several types of stool tests, but for norovirus, a specific type of stool test has to be ordered by a healthcare provider. It may take some time to get the results back. It's best when stool samples are collected during the acute phase of illness, which is 48 to 72 hours after symptoms start. The acute phase is when there is the greatest amount of virus particles in the stool. So now we're going to review a case study for Storybook Daycare. So this morning, Mr. Buzz sent Andy home from Storybook Daycare after he had diarrhea 2 times and had a fever. Andy's mom took him to the doctor, who diagnosed him with norovirus. During nap time, 2 students from Andy's class vomited and had stomach pain. They were also sent home. So now we're going to take a look at a few poll questions that have to do with this scenario we just talked about. So for our first poll question, what symptoms of norovirus were present at Storybook Daycare? Please select all that apply. All right, so it looks like for the most part, everyone did get that correct. So the answers are diarrhea, fever, vomiting, and stomach pain. Remember, when Andy was sent home due to diarrhea and a fever, and then 2 students in Andy's class were sent home for vomiting and stomach pain. All right, so the next question. At Storybook Daycare, there are 3 students within the same classroom with symptoms of norovirus. Should you treat this as a norovirus outbreak? Yes or no? All right. So as you can see, it looks like, we had a mix of answers, but the answer is yes. According to the New Jersey Department of Health norovirus guidance document, which we will talk about later, if you notice 2 or more students in a classroom or group of students with onset of vomiting and or diarrhea on the same day, you should treat this as a norovirus outbreak. All right, so a little bit more info for you all. Andy went to the doctor and was diagnosed with norovirus based on his symptoms. His doctor also took a stool sample for further testing. So true or false? While norovirus is usually diagnosed based on symptoms, stool testing can help identify whether the illness is caused by norovirus.
Hi, Amy, I don't hear you.
Can you hear me now?
Yes, can you repeat that?
Yes, so it looks like there was mostly true. A handful of people answered false, and the answer is true. Typically, we do see outbreaks that are suspected to be norovirus based on the common symptoms of diarrhea, vomiting, fever, and nausea. However, testing is recommended so we can know whether the illness is caused by norovirus. Testing helps confirm the type of pathogen and it allows for tailored recommendations. So now I will hand it over to Tasnim, who will talk about outbreak detection.
Thank you, Amy. So how do you know if you have a norovirus outbreak at your childcare center or school? Because most children or students don't get tested for norovirus, once you notify your local health department, they may decide to use CDC's norovirus outbreak criteria, which includes things like norovirus symptoms, illness duration, and other information to figure out if the outbreak was caused by norovirus or not. The link to this criteria can be found on the bottom of the slide. So now let's talk about outbreak management. The New Jersey Department of Health Norovirus Outbreak Guidance document is a great resource that outlines the common symptoms of norovirus, as well as information on how to detect and report outbreaks, and some effective ways to stop the further spread of norovirus. This guidance can be found on the New Jersey Department of Health Communicable Disease Service School Health page, and we will make sure to drop the link in the chat. Now, if you think you are dealing with a suspect norovirus outbreak, it is important to reach out to your local health department. They can provide tailored guidance, public health recommendations, notification letters, and support to manage your outbreak. So as you start to see illness appear at your childcare center or school, it is important to gather as much information as possible. This will help with understanding the type of outbreak at hand, how to address the outbreak, and provide guidance. So here we have an example of a blank line list. Some information that can be gathered here include the names and ages of the students and staff, how many are ill, whether someone has norovirus symptoms, which we talked about earlier, and that can include vomiting, diarrhea, nausea, bloody stool, abdominal pain, as well as fever. Some other information that you can find on this line list include the date when someone presents with symptoms, the impacted classrooms or rooms within the childcare center or school, and whether anyone got tested. So now that we've covered outbreak detection as well as outbreak management, let's talk about outbreak reporting. While norovirus outbreaks are most common from November to April, they can actually happen at any time during the year. The New Jersey Department of Health Norovirus Outbreak Guidance recommends that you reach out to your local health department when there are 2 or more students and/or staff in a classroom or group who have vomiting and/or diarrhea on the same day. You should also reach out to them when there are twice the usual number of absences due to vomiting and/or diarrhea. It is important to remember that outbreaks are not one size fits all. So when you notice a change from your average day at your childcare center or school, it is important to communicate these changes with your local health department. So we've said this before, but it is important to report any suspected outbreak or any increase in illness in a timely manner. Reporting an outbreak as soon as something out of the ordinary is suspected is very important. This allows us to not only help control further spread of the disease, it allows us to investigate, identify, and remove sources of norovirus infection or any other type of infection. It also allows us to learn about emerging problems, apply different ways to control and prevent further spread, as well as making education, guidance, and disease-specific recommendations. The New Jersey Department of Health General Outbreak Guidance document is yet another helpful resource that outlines reporting requirements and general public health recommendations for common infectious diseases that occur in childcare centers and schools. Some useful tools within this document include the New Jersey Department of Health School and Childcare Exclusion List, a sample notification letter, as well as a checklist of control measures. So while we're talking about the school and childcare exclusion list, this is also a great tool to know when and for how long students and staff should stay home from the childcare center or school, depending on the type of illness that is happening at that location. So when an outbreak does occur, you may need to send a notification letter to parents and guardians. This letter should be made with the help of your local health department to make sure that correct and accurate information is being sent out. Some of the control measures listed on the checklist will be covered in the next few slides. And you can also find this guidance document by visiting our New Jersey Department of Health School Health page, and we'll make sure to drop any of the resources we're mentioning in the chat. So just to take a little break from some of the information we're sharing, we did want to ask you another poll question. And this states, you should reach out to your local health department if 2 or more students and/or staff in a classroom or group of students have an onset of vomiting and/or diarrhea on the same day. Is that true or false? And we'll give you a couple seconds to answer this. Great, it looks like 95% of you answer this correctly with true. That percentage actually may be a little bit larger. I saw some folks adding into the chat true, so appreciate that. The answer is true. You should always reach out to your local health department if you notice any increase in illness. So now let's talk about control measures. Control measures are the actions you can take to prevent further spread of disease. So what can you do to prevent the spread of norovirus at your childcare center or school? Since norovirus can spread by having contact with someone who is ill, we can stop further spread by making sure sick individuals stay home and are out of the childcare centers and schools until 24 to 48 hours after their symptoms get better. So we've discussed this before, but as you can see, here is a sample of the school and childcare exclusion list. And any student and/or staff who have norovirus symptoms, such as vomiting or diarrhea, should stay home from the childcare center or school until 24 to 48 hours after their symptoms get better. Now, if childcare providers or food handlers are responsible for preparing and or making food and they become ill, they should stay out until 48 to 72 hours after their symptoms get better. Now, you may be thinking, why is there a range of hours for the exclusion time? Will it be 24 or 48 hours? Will it be 48 or 72 hours? So some things to think about include how long has the outbreak been going on for? Are students and or staff having ongoing symptoms? And is there continued spread happening across the childcare center or school? So after you consult with your local health department, they will help you determine which time frame you should use. And like we said before, if you notice an unusual amount of students and or staff who are ill at your childcare center or school, it is important to reach out to your local health department. The last portion of this table mentions that even though individual cases of norovirus do not need to be reported, if you think you have an outbreak that is happening at your childcare center or school, you are required to report this information to your local health department. While there is no specific treatment or antibiotics for norovirus, there are steps that can be taken to manage norovirus symptoms. People infected with norovirus are recommended to drink plenty of fluids, to stay hydrated, and to see their healthcare provider if their symptoms worsen. Another way that we can prevent further spread of norovirus is by sending notification letters to parents, guardians, and staff. Notification letters help to keep the childcare or school community informed about a potential or confirmed outbreak by listing out which prevention steps to take, providing background on the illness, noting which symptoms are specific to norovirus, and how the illness can spread. Depending on the situation and spread of illness, these letters may be sent to the impacted classrooms with sick individuals, to an entire grade, or even the entire childcare center or school. A broader notification may happen when siblings attend different childcare centers and or schools within a school district. Here we have an example of a sample notification letter. While this outlines basic information to share with parents, guardians, and staff, it is important to review this letter with your local health department prior to sending it out. This will ensure that the most accurate and up-to-date information is shared, while tailoring the letter to the specific situation at hand. With that, we do have another poll question for you, and this one states, it is recommended to consult with your local health department when writing notification letters to ensure the information is accurate. Is that true or false? And we'll give you a couple seconds to answer this. Okay, great. So I'm seeing the response. I see 98% from the poll, and I did see in the chat some of you put down true. So appreciate that. The answer is true. It is always recommended that you consult with your local health department when you're writing notification letters to ensure that that information is accurate as well as being up to date. So since norovirus can spread from stool to mouth or fecal oral route, and by contaminated objects and surfaces, another good way to prevent spread is by practicing good hand hygiene. Hand washing with warm water and soap for at least 20 seconds is the best way to prevent spreading norovirus. Singing along to the happy birthday song twice while washing hands is a fun way for kids and students to scrub and rub their hands for 20 seconds and get rid of any germs. During a norovirus outbreak, alcohol-based hand sanitizers should not be used as a substitute for washing hands. Rather, you should be alcohol-based hand sanitizers should not be used as a substitute for washing hands with warm water and soap, since hand sanitizers are not effective against norovirus. Now, when you do have norovirus symptoms, as I've mentioned before in the previous slide, washing your hands is very important to ensure prevention of spread. It is also important to have children, students, and staff wash their hands after using the bathroom. For staff who are responsible for caring for diapered children, they should wash their hands after every diaper change. Everyone should wash their hands before and after eating, preparing or handling food, and before taking or providing medication. People sick with norovirus can continue to shed virus particles for 2 weeks or more after feeling better, and they can continue to spread norovirus. So that's why it is important to continue washing your hands even after you're feeling better. And here we highlight a helpful flyer from CDC that covers common ways someone can become ill with norovirus, such as changing diapers, touching contaminated surfaces, so you can think of doorknobs, computer equipment, hall passes, handrails, or toys as possible surfaces or objects, shaking hands, and providing care for people who are sick. And just to provide another break, we do have another poll question. So this one is saying, hand sanitizer is effective against norovirus. Is that true or false? And we'll give you a couple seconds to answer this. So this may have been a little tricky. I see 85% of you answered false, which is the correct answer. And for those of you who did true, just to reiterate, hand sanitizer is not effective against norovirus. However, hand washing is the best way to prevent the spread of norovirus and to effectively kill norovirus particles. So now let's talk about cleaning and disinfection. Cleaning and disinfection of commonly used areas and surfaces also helps prevent the spread of norovirus. Cleaning refers to the use of soap or detergent and water to physically remove germs and dirt from surfaces or objects. Disinfection refers to the use of chemicals to kill germs on surfaces or objects. It is important to properly and safely clean and disinfect commonly used spaces and frequently touched surfaces and objects. Only disinfectants that are approved by the Environmental Protection Agency, otherwise known as EPA, and products that are effective against norovirus should be used. It is important to follow the instructions that are listed on the disinfectant product, including the contact time, and to use a product that is both effective and efficient. Now, the contact time refers to the time needed for a disinfectant product to remain wet on a surface to kill the desired germ. If you're making a bleach solution for disinfection, household bleach should be used. Keep in mind that the bleach concentration differs for routine disinfection versus spill cleanups. So for routine disinfection, depending on the type of surface that is being disinfected, the ratio of bleach to water differs. For example, for stainless steel, food and mouth contact items, and toys, you would use 1 tablespoon of bleach in a gallon of water. For non-porous surfaces, tile floors, countertops, sinks, and toilets, you would use 1/3 cup of bleach in a gallon of water. And for porous surfaces and wooden floors, you would use 1.5 cups of bleach in a gallon of water. We'll wait to talk about spill cleanups in a little bit, but for now, I wanted to remind you that during a norovirus outbreak, to clean and disinfect even more than usual, especially frequently touched surfaces and commonly used areas. So you can imagine that to be bathrooms, shared spaces, doorknobs, telephones, computer mice, as well as toys. So since we mentioned EPA, you can find EPA's List G with a quick Google search of EPA List G. Using this EPA link, you will find their list of approved disinfectants that are effective against norovirus. You will also find a table on the webpage that outlines disinfectant information. So here we see the table, and some of the information that you can find here include the product registration number, active ingredients, the product name, the company that produced the product, the contact time, which I had mentioned earlier, is the time needed for a product to remain wet on a surface to kill the desired germ, the formulation type, the types of surfaces on which the product can be used, as well as the use sites. So here we highlight another great resource from the New Jersey Department of Health. This resource outlines the difference between cleaners, sanitizers, and disinfectants. It also reviews the recommended cleaning practices that can be used in either childcare centers or schools. So now let's talk about spill cleanups. When a vomit or diarrheal accident occurs, our New Jersey Department of Health General Outbreak Guidance has a detailed step-by-step instruction on effectively cleaning and disinfecting an area wider than the actual spill itself. So let's go over these steps together. First, when an accident or spill does occur, you want to make sure to block off and clean up the spill as soon as possible, using one of the disinfectants that are approved by EPA's List G. The products on this list are all effective against norovirus. You can alternatively use a freshly prepared 10% household bleach solution. This solution can be made by mixing 1 2/3 cups of bleach in a gallon of water. Now keep in mind, if you are using bleach, this solution should be made fresh daily. And again, as a reminder, the bleach concentration that we use for a spill cleanup is much stronger than the concentrations we would use for routine disinfection. When a vomit or diarrheal accident occurs, our New Jersey Department of Health General Outbreak Guidance has a detailed step-by-step instruction on effectively cleaning and disinfecting an area wider than the actual spill itself. So here we highlight another great resource from the New Jersey Department of Health. This resource outlines the difference between cleaners, sanitizers, and disinfectants. It also reviews the recommended cleaning practices that can be used in either childcare centers or schools. You can also find a table on the webpage that outlines disinfectant information. So here we see the table, and some of the information that you can find here include the product registration number, active ingredients, the company that produced the product, the product name, the company that produced the product, the product Next, while wearing disposable gloves, make sure to spray an area wider than the vomit or diarrheal accident with a disinfectant from EPA's List G. Consider a 10-foot range of the spill. You don't want to miss any splatters. And if available, disposable masks, aprons, and eye shields may also be worn. Then, use disposable cloths or paper towels to soak up the spill. Next, clean the area with warm soapy water. Then, spray the area with an approved disinfectant from EPA's List G. Make sure that anything that's cleaned or disinfected is dried before use. This is especially true for any items which young children may place in their mouths. So consider toys as an example. Remember to place all used disposable items in a sealed bag. And of course, lastly, make sure to wash your hands thoroughly when you are done cleaning up the spill. And then, of course, you would throw the bag away into a wastebasket. We also wanted to highlight and share some new norovirus resources from us, the New Jersey Department of Health DISH team. These resources are great to share with parents, school administrators, nurses, as well as childcare staff. We created a video about norovirus that not only discusses what norovirus is, it also covers the common symptoms, how norovirus spreads, and some helpful prevention tips. On our website, you can also find 2 flyers, which we have highlighted on this slide. One is in English and the other is in Spanish. These flyers are perfect to hang in your childcare center or school. For more information on norovirus, as well as other common infectious illnesses in childcare centers or schools, please make sure to scan this QR code so you can access our NJDOH DISH team webpage. We also wanted to highlight the resources we used for today's presentation, which we've made sure to drop within the chat throughout the presentation. And of course, thank you so much for joining us today. We wanted to take the